just being biologically minded. It's not to say that I'm not biologically minded. My whole reason for getting into psychiatry was because I was excited about the mind and the brain, and neuroscience was something that excites me very much. I still do a lot of work. In fact, I will be talking at the Nuclear Medicine Conference in April about brain changes and doing spec studies on psychiatric patients. And it's a lot of fun. It's a lot of fun to try to put together the pieces of all of this. Unlike many other people, I didn't go because I felt that, see, I came from surgery, so I was about as heroic as you could be in medicine, and it's always downhill from there. You have to give up a certain amount of altruism if you have to do psychiatry and neurosciences and stuff, because, and you have to look at the whole picture, and not just in terms of, people don't necessarily come to you with a box of candy at the end of their hospitalization. You know, you sometimes get letters from lawyers that so you have a different population, and the same population relates to you differently when you are involved with them in this way. But I went from, really, when I was doing psychiatry, I was interested in the more difficult cases, those involving violence, psychosis, self-destructive behavior, because going from surgery to do something, to sit and hear somebody on the couch 5 years straight, 5 times a week, seemed to be relatively meaningless when it seemed like there wasn't this intensity of anguish, at least in the way that I felt it at that time, that these are really not people in anguish. If you stay in Beverly Hills and your chauffeur takes you down to your favorite analyst in one of the towers, and you kind of chit-chat for 45 minutes to an hour, and he makes his regular ahas, you somehow don't think that this is really meaningful. So I was treating the more serious, I was always interested in treating more serious cases, but the message I was getting all the time was that this is hopeless. You don't treat borderlines. In fact, I was told that you don't spend time with borderlines, you make sure they're sitting far away from you, you see them 15 minutes at a time, and space your sessions very at great distances from each other, and don't take phone calls, don't be available, because they'll just cling on to you. And of course, you medicate them as much as possible. In those days, we used massive amounts of neuroleptic medications back in the late 70s. Basically, used a lot of Haldol and Thorazine because, again, they came with behavioral problems. I began to sense that this was not, as I got more interested in ego psychology, because this Freudian stuff was not making sense at all. I mean, 10, 11 years down the line, I recognized that it didn't make sense to start out with. I mean, I had one of my teachers, the first day in my psychiatric residency, Dr. Edward Kaufman, who is, I have no problem naming names. He is supposed to be working with addicts, and I really feel concerned for the people that must go to him. But he asked me what was the symbolism of a snake. I'm from India. We worship snakes, like we worship a lot of other things. And so I didn't give him the magic word, which was penis. And of course, he thought that I was not really dedicated towards psychoanalysis. So I did get a lot of supervision, and a lot of my background has been in psychoanalytic psychotherapy, and most of my teachers have been so. But I really got into ego psychology, and once you get into ego psychology and self-compelled to look at childhood. One of the psych journals from last year has this big heading on page 2. It's kind of like National Enquirer. Psychiatry shows that childhood events have nothing to do with adult psychopathology. It's like one of those things, it's like National Enquirer, this. And you're wondering where these people are coming from. But it became very obvious to me that there's a very strong connection between what happens in childhood. In a sense, it is when adults behave like adolescents, become rambunctious, violent, self-destructive, out of control in different ways. Those are the problems that we face in adults that don't function well. And the problems of adolescence, which is what I started doing next, are really the problems of childhood that have not been resolved. And throughout all of this really is the problems of infancy. It is the problems of autistic relatedness, or the lack of relatedness, severe withdrawal, self-hate, a lack of passion in life that we are dealing with in adults that are our most difficult problems. You know, it is not the little band-aids that we supply, but the sense of meaninglessness about life, being overwhelmed with depression and hopelessness and boredom and a sense of lacking direction and a sense of existential angst that a person struggles with. These are our major problems, and yet psychiatry and psychoanalysis has addressed it very, very little and come up with very poor solutions, some of which, as you know. How many of you are familiar with the writings of Alice Miller? Okay. She's a psychoanalyst, and she's talked a lot about the denial within people about sexual abuse. I still have psychiatrist friends, neurologists, that still refuse to believe the stories of children. Again, it is hard for people, if they don't go within themselves, to see how grown-ups abuse children physically, emotionally, all of that. I went from treating children to looking at infancy and the very young, and a lot of the work that I did with the very young, like newborns, infants, is really what has given me an insight into some of the things that have helped me tremendously with adults, and recognizing that all the talk therapy in the world cannot help a person. I think about people like Marilyn Monroe. I mean, to me, reading the life of Marilyn Monroe, it is very, very obvious to me she's an abused child who had a dissociative disorder that was diagnosed as manic depressive, borderline, everything medicated hugely with meprobamate and things like by her psychoanalyst, and who never looked at her abuse, never ever looked at her abuse. And yeah, that was his book. I forget his name, but he was a professor at UCLA. But his book was the standard textbook that we used. He has a case in that where he talks about a person who has been seeing him for 5 years, and at the end of 5 years, his patient has a breakdown, and this time, Ralph Greenson. Have you heard of Ralph Greenson? Ralph Greenson's psychiatric technique is a little thick black book. He figures that the patient really needed supportive psychotherapy and do a LCSW for supportive psychotherapy. And I'm thinking, this guy missed the boat the whole time. You know, because you should be able to identify over the telephone or when a patient walks in and talks to you, from the way they look and they relate to you, and from the history taking, that they have significant nurturing needs. You don't wait 5 years to find out that your uh-huhs didn't work, and you should have been maybe showing a little more of compassion and passion and relatedness in your therapy. And but it's that kind of thing. But you have to work with the child in the patient in order that they will get better, because it is the childlike and the infant's problems that are the most difficult for a person themselves to overcome, and where they need the greatest help when we do give help. And if you don't address that part, we may not be helping them at all. In fact, maybe we will just be prolonging their problem and leading them through false paths of recovery. I have, how many of you are familiar with the term codependent? Okay, all right. Well, I have, by definition, codependency is where somebody is, in a sense, addicted to another person, usually the wife of an alcoholic or an addict. That's a codependent. My definition of codependency is that it's a condition where one person's thoughts, feelings, and behavior are so influenced or so enmeshed with another person, a significant other. Could be usually a lover or a husband, but could be a parent, could be a parent, could be a co-worker, a friend, an institution, a country, all of these cults. I mean, you find tremendous enmeshment with cults and the way cults tend to control individuals. Yes?
Your own child?
Can you codependent your own child? Oh yes, happens all the time. Where a person either has emotional distress, where a person then has emotional distress, physical pain, or it takes away from them the sense of their quality of life, their creativity, and their capacity to dream their own dreams. Okay? So, on one hand, you have somebody that's obviously codependent. She comes to your office every other week, misses a few sessions because her boyfriend doesn't let her go, comes with black eyes, and is very obviously codependent. She's supporting her third boyfriend this year. It's very But you have others that are married to doctors and lawyers, could be both male and female. This is the 90s. That don't live their own lives, that don't dream their own dreams, that put their life on hold to be in the shadow of somebody else's light. And that kind of codependency is much more widespread. But the roots of both come from the same. An inability to shine one's own light, not being connected to one's own flame, and being that being the strongest motivator of one's life. That is a much more prevalent kind of problem that is much more easily missed, and people are not going to come forward to treatment, and where as professionals we are much more likely to overlook that maybe there is something that keeps this woman that graduated from Ivy League school but is being in abusive relationships and never went past working as a house slave for her husband. And maybe there is something there that prevents her from feeling proud and anxious about life. I believe that behind every codependent and addict is abuse and neglect. Okay? Whatever the addiction is, whatever form the codependency takes. I mean, ACAs. Another thing which I think is very important is maternal deprivation in the genesis of this kind of abuse and neglect. And we don't see maternal deprivation as being something, we think about it as not being so toxic. My sense that it's a very, very toxic condition that we need to focus on very strongly, and that it does tremendous harm to children. And on one extreme examples you see is when mothers get psychotically depressed. You hear about postpartum depression. There are many, many reasons why people suffer from postpartum depression, and we can spend a whole hour talking about that. But it's only when you get postpartum depression with psychosis and a woman kills a child, that's the time when you hear about things like that, or kills herself, and you hear about things like that. But you don't miss the large numbers of parents, mother and child, whose sense of attunement, this magical connection, this dance that they're supposed to have with the child, with the heartbeat and the smell and the sight and the looks in the mother's eyes, go to form a process that nourishes and makes the world safe and at the same time exciting for the child. So deprivation takes many forms. You think about mothers very often. They may have a first child that they parent and are fully available because they're in love with their they're in love with each other. They feel supported by their husbands, all of that. And then maybe by the time they have the second child, she has suffered the loss of a parent. Maybe the love life has kind of worn off a little bit. And with the second birth, maybe she is not able to give the kind of rapture and excitement in the relationship with the baby, and that constitutes a certain degree of deprivation. And then, so that becomes like an organizing factor for other kind of wounding. I believe that all codependency and addictions come because something of a non-nurturing kind something has happened at a time before the age of 3, maybe even prior to that. Okay? And then from then on it becomes better or it becomes worse. But if a child has had a good enough environment, stable enough mothering up to the age of 3, my experience and my sense is that they are relatively invulnerable towards major psychiatric illnesses and codependency and addictions. Okay? I believe this very strongly. This is the focus of our treatment at the Codependency Center. Because people that are brought up with love and respect, sensed in an intertwined manner, where love and respect go hand in hand, will not grow up to be people that either abuse themselves, abuse others, or allow others to abuse them. Okay? They will not, all kind of signals will go off to a person that has seen their mothers treated with respect, who has seen their sisters treated with respect. It is not whether, I mean, today we have a problem. There's lots of soldiers in Saudi Arabia. There's a lot of women that are alone without their boyfriends or their husbands. It is not so much whether the male parent is absent or present as to what maleness is felt within a person, male or female. If there is a sense of seeing men to be noble and non-punitive and tender and courageous within women, if they carry the archetype of the hero within themselves, they are going to see the same kind of, you're going to see the same kind of glory in the way that they interact with their male children, and we're going to see the same kind of glory in their interaction with the female children. On one hand, you have an idealized birth where from the time the conception is looked through with excitement, and the couple is in love, and she has support from her parents and his parents, and the birth of the child is looked towards as with a sense of excitement, something sacred, something wonderful going to happen from everybody around her. Okay? And such a child is on good terms with the mother even while he or she is in the womb. The chemical constitution of the womb is different. Just like, and this is very easy to imagine, because when you're anxious, you are chemically one way, and when you're depressed, you're chemically one way. When you're elated, you're chemically one way. When you're excited, you're chemically one way. So, and this is not just, a lot of this is researched. Even though we don't have all the pieces, a lot of the pieces are very, very obvious. How the brain grows, how this tract that is like, it's really a part of the skin that kind of goes inside, and that is why the skin is so important. The skin is like a big part of your nervous system, but it's really the skin that kind of goes in and goes on, the skin that connects your inside to the outside. That is what goes inside and becomes your nervous system, that both connects your inside to yourself in a larger sense and connects you to the outside. But the growth of the brain is directly influenced by the hormonal, biochemical environment of the mother. And if she is not supported, if she is not honored, if she is not soothed, if her own childhood has memories of trauma, it affects the way that she interacts with the child. Dan Prue from the University of Colorado, who died some time back, had the study where he would see if people had chosen names for their children. And for people that had not chosen, women who had not chosen names for their children, it was like this parasite that came into them that they don't want nothing to do with, If they haven't chosen names, the attitude of the mother in terms of choosing names or not choosing names had a lot to do with later outcome in terms of how the children did. And there are so many things that happen while the child is in the womb and in early infancy that have so much to do. But most of all, I want to underline the tremendous capacity of individuals to overcome what they come with. There was a show on PBS several years back where there was a child who had hydrocephalus. Almost all of her brain was damaged. It was there was a thin slice of brain right at the back. The whole skull was filled with fluid. There was a sliver of brain on a section, and this woman was going to college. There was a sliver of brain right in the back, and that was all that was left. But the brain has tremendous adaptive capacity, and that is why it is so terrible to see children being given up as mental retarded, which is often misdiagnosed, deaf people. A term that I use a lot of times is pervasive developmental disorder, not otherwise specified. Which means that the blossoming of the petals of the child's function is not taking place in an even manner. You can be bright, but maybe you start defecating when you're not supposed to. But it doesn't mean that your life is not as salvageable, or that it cannot be as glorious as somebody else's life. We have excessive focus on cognitive society because of the way we are made, where we tend to label children learning disabled and give up on them, and later they go on to become the misunderstood sociopaths that wind up in our jails and all kind of problems. But infancy and prenatal development have a lot to do with this, and the sense of abuse and neglect can happen in many ways, and it might not be contrived, and it doesn't have to just happen with alcoholic families. It can happen within many families with different levels of dysfunction, that it sometimes may be relatively well functioning, and at other times there might be something that just kind of throws the balance to a side, where a child's capacity to connect to himself and begin to develop in a healthy manner becomes impaired. Neurologically affected children, children that are born prematurely, children that spend long periods of time in the hospital at an early age during infancy with all kind of problems, children that are not touched because of this kind of enforced separation, can all then have problems relating to the mother. And once this relationship with the mother is affected, then the way in which the brain blossoms begins to get affected. We have to realize that if you're a kangaroo baby, you come out very early, and even though you're as big as a worm, you make the stadium-length crawl to the teats of the mother, and you have the strength in your little arms to do that. Or if you're a baboon, you can climb on your mother's back or hold on to the hairs right after you're born. But human babies come out with long time of work needed between mother and child, like maybe a year too early. And it is not a weakness, it's a strength, because even though without instruction we will not be able to fly 4,000 miles guided by starlight like the birds who are powered by their instinct, we have the capacity to choose and be creative and make a world that we decide how it's going to be for ourselves. Because we have the power of culture, and we have the power of tradition, and we have the power of creativity that other animals seemingly don't have. Okay? So it's not bad, but it points to an area of vulnerability. This infancy really points to an area of vulnerability, and that is where we look for the problems that have to do with chronic hopelessness, boredom, rage, uncontrollable violence, self-destructive behavior, eating disorders, in a sense where even bright people seem to be stuck in their capacity to make change in their lives. I believe that all people that are having problems with addictions and codependency suffer some kind of PTSD. We can talk more about PTSD when we talk on multiple personality disorder tomorrow. Is everybody familiar with the term PTSD? Okay. Again, it is not just the nature of the trauma. It's the holding environment. You can have terrifying things happen in a person's life. If you look at it, when London was being bombed in World War II, a sense of communication between the people personal heroism, warmth between people intensified. The degree of psychopathology that came out during the war years was no more than in later years, and some feel that it was less. Okay? So it's not what is happening to you on the outside. As long as a child feels safe within the crucible of the mother's love, the mother feeling safe within the crucible of the larger family, her husband, her lover, her parents, her society at large, then she's a safe environment for the child. And such a child is going to be even more significantly invulnerable to real trauma later on. There is nothing like too much love. Okay? There is nothing. And you hear all the time, too much loving, spoiled by love. There is no such thing. Yes, there is taking away of a child's boundaries. There is communicating your personal sense of distrust to the world if you prevent a child that in its blossoming is at a stage where he or she needs to run away from you, okay? Needs to walk away from you. And if in your fear you hold back and insist that he or she not walk, that is not spoiling, okay? That is crippling. These are different things. You cannot give too much love. Okay. The thing is, so it's not just the nature of the trauma. It's really not the nature of the trauma. It really has to do with the nature of love. Unselfish adoration and love within a person that feels good about themselves and the world around them is always nourishing. And the more you get, the stronger you become, and the better your capacity to ward off whatever kind of craziness takes place from there on. Have you read the works of John Bowlby is a good source for this kind of stuff. Winnicott, all of this. But infant observations in individual and large numbers have helped us connect a lot of the psychoanalytic theory to this, to these things. So I wrote down, I once treated a codependent. But I still have this thing. It's like a lot of times when you talk to therapists and psychiatrists, they'll say, yes, I treated a codependent once. It's like, it's this rare thing that kind of walks into your office sometimes. No. The thing is, it's because we don't recognize it. They come in all forms. I mean, I treat the same patient population. I mean, I have a fairly consistent set of diagnoses that is applied to almost all the patients that come in. If they come into the hospital, it's major depressive disorder, recurrent type, with or without psychotic episodes, and melancholia. The number 2 is post-traumatic stress disorder. Either it's there and it's recognized, or it's not recognized, and there is psychogenic amnesia or dissociative disorder with psychogenic amnesia or various forms of dissociative disorder. You have psychological factors causing physical symptoms. It is always there. As professionals, I'll tell you, psychological factors causing physical symptoms is always there. They have tension in their back muscles. They have headaches. This becomes a good way to justify physical therapy and massage. It's just here's some insight in for you. Okay, you also have a lot of organic brain disorder because children that are brought up in abusive families, but there isn't this kind of nurturing. Either there is too much stimulation, daddy wants to just come back from his important business trips and wants to play with Johnny at 3 o'clock in the morning while he's a little drunk and teetering, So you have this unbalanced affect, too much excitement, too little excitement, so this lack of balance, sleeping and waking and all these things are so disturbed that you find subtle organic brain disorders a lot in this population. You have most routine neurologic exams are negative, but when you look at neuropsych testing, fine touch, learning disabilities, total neurologic problems a lot in this population. And if you do heavy involved testing, you will find that. We do a lot of sophisticated testing like PET scans and computerized EEG because it's good for documentation. I'm also excited just by looking at the whole picture in terms of, but that's another diagnosis that you will see in this population, organic brain disorder. And a lot of times the organic brain disorder is caused by abuse of alcohol and drugs. things like cocaine. For example, if a person, we see a lot of temporal lobe injury with cocaine. When you do SPECT studies, I have a few of them with me on slides, but you actually find injury to the temporal lobe where structures are damaged. And this is one of the reasons why, because significant brain tissue that has to do with regulating neurotransmitters is damaged, this is the reason why you find prolonged depression and cognitive failures after cocaine abuse. Also true with alcohol. So for about a month and a half, the brain doesn't heal itself to where you can start doing your program. Okay? And a lot of it just, you can only focus on making sure that they contain, that they don't abuse drugs again while they're in the hospital or while they're in the program, that kind of thing. So they come in various forms. My feeling is that most psychiatric problems have to do with abuse and neglect at an early time in life. Okay? Sometimes people remember the problem, sometimes they don't. And that these problems can be noticed all the way from infancy through old age. You can see the signs and symptoms. They present in different ways. I put down in this order: behavior, medical problems, mood problems, thought problems, interpersonal problems, and finally diagnosis and misdiagnosis of abuse-related problems that we see in codependency and abuse and addictions. The signs in infancy are that you have either they're hyper or they're withdrawn. You find them going back and forth. But the sense of loss of balance and movement. Okay? I put down behavior as number one because, once again, people can do all kind of, you can feel terrible, you can feel suicidal, but as long as you don't act on things, nobody notices it, you know. You can suffer as much as you want, but behaviors are what we are more concerned with. Society focuses on behaviors. And so, as in infancy and childhood, it just takes various forms. In infancy, you find hyperactivity, withdrawal, colic, things like that. Later on, you find disturbances of aggressive behavior, self-destructive behavior, aggression towards others, disturbances of sexual behavior. I put down next to aggressive, I put up and down. The thing is, I have to say, in codependence, the number one behavior problem is a failure of appropriate aggressive behavior. Okay? The inability to decisively act in aggressive manner is the single biggest problem. And that is the reason why they are repeatedly involved in situations that they're abused. The dissociation, the psychogenic amnesia for early childhood trauma, combined with this failure to act appropriately aggressively, is the reason why they continue to be in abusive relationships that run through generations. Okay? You hear somebody's story and you ask them, how come you didn't take a baseball bat to his head? You realize it doesn't come to their minds. They space out. When they come into situations which need aggressive action taking, they disconnect. Okay. Disturbances of the sexual behavior. Again, I wrote too much, too little, or deviant. Okay. You will find, and again, the number one problem at a universal level is an inability to enjoy healthy sexual feelings, especially as they get older in age. It is the person that acts out sexually and becomes gangbanged at the age of 14 and has group sex at the age of 18 that at the age of 40 has no capacity for sexual enjoyment. I mean, I have lots and lots of patients who have a very impoverished sex life as they get older, even though it was like a major focus. So you find both things, but it becomes less and less rewarding. And deviant sexual behavior. I mean, I talked earlier about the biggest deviation really being not being sexually active, not being able to enjoy one's sexuality, this God-given sense of ecstasy that is so important in our lives, not being enjoyed. We talk about, I have a feeling that there are lots and lots of people that go into the priesthood, for example, that have sexual problems. I've treated lots of priests and nuns, but I think as a whole, especially within the Catholic Church, there are more people who have abuse problems that wind up into the priesthood. And I'm not saying that they forever remain sick people. I think a lot of them overcome that, and sexuality ultimately is not the only thing in your life. One can become glorious in many ways. So I don't think that every person that becomes a Catholic priest is messed up and stays messed up. I'm sure that's not the case. I'm aware that a lot of them go on to become wonderful, loving, self-respecting people that enjoy life and feel great. But as a sample, I'm sure that there is more, because it's a form of denial, it's a form of negation, it's a form of abuse. Okay. In adolescence, you find the sexual problems coming on, but again, premature sexuality in childhood, excessive masturbation. I don't think that every child that masturbates a lot has been sexually abused. I don't think every adolescent that masturbates a lot has been sexually abused. Very impoverished environments will lead to both self-mutilation as a sense of finding oneself, as well as masturbation. Okay, so it's not just like you got to be touched by your babysitter or your father or mother that causes you to become sexual acting out and things like that. So very emotionally impoverished environments can lead to sexual deviant behavior as well. I have a lot of patients that have sex with animals, make phone call sex and all this stuff that have had exactly those problems. We treat a lot of sexual addiction and sexual deviant behavior. The problems in adulthood are really a continuation of the problems in childhood and adolescence: eating disorders, chemical dependency, generally problems of impulsivity, passivity, compulsivity. And what you find in later life is some of the aggressive behavior goes down. It is often translated into physical problems. I have left this empty only because we'll be running out of time if I go too much into it, and I will be talking about it in one of the later workshops tomorrow on the physical problems. But let me say that this is a very important area for codependents. Codependents are much less likely to come and tell you I'm codependent than come and tell you I got migraine headaches, I got back pain, I feel general weakness, stomach pain, all of these things. I have a little chart that shows all the things that I will show you tomorrow. But from the head to the toes, you find all kind of problems affecting every system in your body. Nervous system, gut. Gut is very, 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 very common. GU, for example, you may have heard in the last year that a lot of people with GYN problems have been molested as children. In fact, there was an article in 1990 that 40% of women that had multiple laparoscopies had been sexually abused or incested. Okay? And these are the ones that remembered. Okay? But for years and years, gynecologists have regularly written prescriptions. Drink a little gin, that'll do good for your PMS. This is the kind of... Actually, I have a relative that just had a baby, and the GYN has told her that one way to calm her nerves down is have a few drinks. Okay. So medical problems can be a very, very strong clue to abuse and codependency that is happening in the person that needs to be addressed. Okay. Mood problems. I talked earlier today about misdiagnosis and mistreatment. This is where psychiatry has been most effective and most dangerous in its treatment. When a person comes from a background of abuse, where love and hate, happiness and joy, happiness and sadness is all perverted within their minds, where they have not been adored and loved in childhood. There is a lot of pain. Believe me, we all know that every person that comes from a background of abuse carries a lot of pain. We don't have to look into their genes, as I said earlier. Just look for the manic depressive gene to find out where they have mood swings. I don't know a single survivor that has that doesn't have mood swings. I don't know a single one. Either they're chronically depressed or they alternate between depression and various forms of negative affect, like depression, rage, boredom, anxiety, jealousy, panic. Either you are dealing with the loss of your childhood, loss of parents, either you're losing, or you are dealing with a threatened loss. You live your life fearful of threatened loss as an anxiety, panic, or you live it because you're enraged at the loss of yourself, or you do a silent kind of pathologic mourning that lasts a lifetime. But to have negative moods in the wake of an abusive childhood, especially when you cannot remember where this pain is coming from, it's easy to understand that you don't need to label them as manic depressive. And that's one of the reasons I talked earlier. I have not used lithium in 3 years. I have not felt the need to. I think manic depressive illness probably exists as a specific entity, just like schizophrenia exists as a separate entity. What I'm opposed to is the arbitrary diagnosis, labeling, and medication with dangerous medications for so-called bipolar disorder. In one study, for example, on routine kids that were not sent for psychiatric or behavioral referral, the study showed that 1 out of 7 kids were hypomanic. So the suggestion is that 1 out of 7 is going to grow up to need lithium at some point in time, a drug that is toxic to your heart, toxic to your brain, toxic to your thyroid, and toxic to your kidneys. Again, I can give you more about all the toxic effects, later on. But you don't have to look at psychiatric disorders to find why people have these symptoms. As adults, we have choices. We always have choices. Choices may be painful. Life can be painful at times. We never know for ourselves what the next deck of cards deals to us. When I pass someone on the freeway, driving in Los Angeles, you hear this on the radios, multi-car crash. You see people killed on the freeway. You never know what happens. It is knowing that you have lived your life in fullness and that you have loved completely that is the only task that you can be sure about from day to day. Are you fully connected to yourself? Do you fully love yourself? Do you fully love the people in your life? But you can never know what's going to happen next. So we all have reasons to get sad at times. We all have reasons to get anxious at times. But when it comes to codependents and addicts, there is a pervasive, uncontrollable sense of depression and hopelessness and boredom and rage. And these are not adult feelings. These are the unresolved feelings of childhood because they cannot connect up the memories. There is no picture memories connected to these feelings. When there is nowhere to turn to, when the very people that are supposed to love and protect and nourish and adore you as a child turn against you and rape you and take you off your feet by your hair and slam your head against the wall and call you a cunt. Okay? Don't respect the boundaries of a body and do things to a person. When this kind of violation takes place, people are forced to learn to dissociate. People are forced to learn how to transmit their agony into their muscles, into their gut, all of these things. But they are left with the sense of boredom and rage. When you find sudden suicidal feelings, it's very common in adult survivors. They find one day and the next hour they're suicidal. And the next morning, one phone call does it, and suddenly they're ready to go to Disneyland again. But this sudden change from intense low mood and hopelessness, it is because it has been pushed. It is disconnected. It has been pushed away. When your pain is so much, one of the ways in which you deal with it is to disconnect from it. When you come from a family that is willing to hear your tears, see your tears, hear you, tolerates your anger, you can maintain continuity of feelings. But when you have a family where your very living depends upon being able to smile when you have to smile, even though you're going to be abused in the next hour and you were abused before, when you have to be raped in the middle of the night, or be physically hurt, or be shamed in other ways, and then you got to sit at the breakfast table and act like nothing has happened. You learn to dissociate. You learn to hide these feelings. But sudden feelings that seem to be disconnected from others, discontinuity of intense feelings, is a strong indicator of early childhood abuse that is not remembered, and very, very common in addicts and codependents. In fact, one of the things that will happen very commonly in addicts when they give up alcohol and drugs is that they have mood problems, they have nightmares, they start having physical problems, and this can happen. This often sends them back into the addiction or sends them to a cross addiction. I find, for example, a friend of mine was telling me that it is very common for people in the first year of recovery, men, to be drawn towards incest survivors, because they just take on a codependent relationships. Addiction and codependency being so parallel a thing. One is the soil and the other is the fruit, and it's a continuing thing. But when the addiction is given up, these are the feelings that come out. These are the feelings that a child was trying to fight by using the drugs and alcohol. For a child that has survived the nightmare of their childhood within a dysfunctional, cold, violent, abusive, ritually abusive some family, alcohol and drugs is like a ray of hope at the time that it happens. I mean, I hear this all the time. I smoked my joint when I was 10 years old, and it's like my life changed at that time. You know, you kind of signed off. And these are the feelings to be expected, and these are the feelings to be worked through. These are the feelings for one must begin to attach names and places and faces. Okay. Thought problems, of course, low self-esteem, self-hate, a lot of paranoia, homicidal ideation, suicidal ideation, obsessive thinking, hallucinations. And these are the things for which people are constantly medicated. You're constantly medicated with very, very toxic drugs for hallucinations, very, very toxic drugs for obsessive compulsive problems. And of course, no psychiatrist, therapist wants to hear about suicide because you got to rush them into the hospital. See, for many people, suicide in childhood has been like a trump card. It is the one thing that allowed them to get through the night, knowing that to ruminate about suicide, to think what they look like being in their coffin, to see how others will react to their suicide. To constantly think of suicide becomes an escape. And many children in abusive families will spend many, many hours, many, many days thinking of suicide, planning suicide, playing with it like a little toy in their hand, something that they can get away from the rest. next night when everything around them is so crazy. So you don't have to treat suicide with putting them in the hospital or think about it every time as being something ominous that you got to go and prevent them. I tell patients all the time that I have no way of stopping them from committing suicide, that even within a hospital setting, it takes 15 minutes for them to kill themselves. They can hang themselves from the doorknob or in the shower in 15 minutes and be stone dead, where you cannot revive them. The only way you can keep somebody alive is one-on-one at arm's length. I have seen women, one-on-one at arm's length, cut their bellies with plastic spoons and forks, create internal injuries inside their gut and inside their uterus. One-on-one at arm's length, working with sharp objects under the blankets, okay? You can't keep somebody else alive, and you have to give them that power. One has to decide between life and death. And mind you, they have chosen many times, and most of the time they're in your office because they have chosen to live. We must reach the heroes within the people if we are able to give them the real tools where they can eventually get better. But these are the kind of thoughts that they will have. Okay. Interpersonal relationships, again, it is hard for people that come from a background of abuse to see people, to treat other people and be treated with love and respect. They can see people up there, they can see people down there, but they're unable to see them as equals. Okay? It is very, very common for abuse survivors to be abused in two relationships and be abusive in another one. It is very common for people to get abused by their friends and their employers and abuse their wives or their children. Very, very common. So the whole thing is not being able to relate to the other person on equal terms, not being able to see the other person as glorious, godlike, all of those things, not feeling connected to the glory within oneself. So I've written abusive, masochistic, including sexually masochistic. Relationships are often sexualized when your way of connecting to people has been being described as a good fuck or a good pair of tits. That is how you relate to people. That becomes, anytime I see a person that has worked as a prostitute, go-go dancer, anything that is a very highly sexualized type of lifestyle, I know that they have a dissociative disorder. I know they have been sexually abused. It begins to fit, because people that respect themselves will not sit on a table and spread their legs in front of a bunch of cheering people that remind them of their fathers and their stepfathers and their fathers' buddies. It happens because you disconnect. There is a certain power that a 6-year-old or a 4-year-old acquires when she sees a grown man begin to tremble and moan in her arms. And this becomes like this negative power that goes on to form lifestyles that are so destructive. If you read the book by Linda Lovelace, she's written a couple of books, one of which has a foreword by Gloria Steinem. But she talks about this man that was her boyfriend has already lent her out to pay his dental bills and a lot of other things. And then she's shocked when he has 6 guys coming to have sex with her and he wants to make a film. Up to these things. These things are a part of an abused person's life. It is because of psychogenic amnesia and repression and denial and continuing abusive lifestyles that people are not connected with the pain. So, aggressive lifestyles, a lot of people-pleasing, manipulation, manipulative behaviors, all of this. Various forms of pathologic interpersonal interactions. Not being able to recognize when one is in danger, or not being able to do something about it when one is in danger. Not being able to see alternatives. It's because they are not allowed to play as children. When your whole life is centered around who's going to kill whom tonight, who's going to put you down, Who do you have to worry about today? When your childhood, with all its capacity for play and creation and looking for alternatives, has been taken away from you, these thoughts don't come into your mind. It becomes very narrow. It becomes very constricted. No alternatives. And that is why, in terms of treatment, it is so important to make play a part of recovery. I tell people all the time that if you're not playing, if you're not taking time to play, you're not in recovery. Because you cannot do the work of recovery if you're not playing. If you're not playing, you're not connected to the child that is capable of dreaming, capable of taking you to a different place, to a more glorious place. That part of you that can never be defiled. Because even through all the abuse, the spiritual child, whatever you want to call it, the divine child, that part of us that can never be tarnished lives on. You know, if you have treated multiples, they will talk about it in different ways. But there is a part of us that never gets destroyed, that never gets sullied. We may have to destroy Saddam Hussein, but there is a part of Saddam Hussein that obviously wants to be loved. I mean, even the people that are most hateful want to be loved, nobody wants to be hated by their children, you know? Everybody wants to be loved. And people strike out in different ways, but it is always reaching out in some way or the other. So there is always a spark of love and a flame within ourselves, and people that have problems that play allows them to become connected to. So all treatment and self-help needs to focus on, besides doing memory work and body work and all of these things, play is very, very important part of treatment, and allows then for people to look at other options. I want to, this overlap of codependency and addictions. I mean, I was treating a patient. She came in with, she's 18 years old. She came in with a history of cocaine abuse and promiscuous behavior. She has depression and borderline tendencies. She is involved with someone who also became my patient later on, that his father was a physician. He was in the airborne, chose the most violent form of, most risk-taking forms of military careers. Very abusive relationship. I treated her mother, who is a codependent, is married to a man that abused some other of her children, a pedophile and an alcoholic. This patient's mother said she was never abused. Her childhood was very nice. She had a mother that was a martyr, worked 2 jobs straight, married 3 alcoholics, who took away all her money and her homes, but she was a martyr. My patient's mother was never abused. But there is a thread, you know, that people are not able to pick up, that we as professionals need to be able to pick up. There is always abuse, there is always neglect, there is always codependence that gets transmitted from person to person. I had a patient, I have a patient, I mean, these are, so I don't actively work with some of these patients, but came in with depression and cocaine abuse. Her mother was a workaholic, a high achiever in school, married to her father is a rageaholic. His own history, his brother committed suicide, this patient's father. Her uncle committed suicide by a gunshot wound. Her father was a rageaholic. He was abandoned at the age of 4 or 5 by his own parents, who were alcoholics and never together. He was abused in boys' homes at the age of 9 and 10 by various boys that sexually abused him. All of this was recalled during treatment. A lot of unresolved grief issues. You know? See, when we treated the kid, we had to look at the parent, and in this case, the parents were people that felt right about being able to look at their lives, and this was the trauma that came out. The woman's father was a perfectionist. He was a religious addict, was very cold, an angry person. We didn't see any sexual abuse with her, but you would be surprised, again, how many religious addicts are also sexual addicts. I have, in fact, three women, three people, so two of them are children and one is an adult, whose grandparents were preachers and incested either themselves or their mothers and committed suicide by gunshot wound. It is very important, again, to remember things. We treat people for codependency and incest and addiction problems. I don't think that in theory we do anything different, but we have a different emphasis because we believe that a lot of the pain is contained at an unconscious, nonverbal, bodily level, or that the mechanism of dissociation, or the capacity to split, has already taken place by that time, that even later memories will be pushed aside. I mean, it's very common to see people not remember things from the time they were 13 years old, where they dissociated large parts of their lives. But we feel that getting in touch with memories is absolutely essential. So I believe in my own work with patients that I absolutely insist that people work towards recovering memories and to use every available way to get in touch with memories. Everybody believes that it's important to get in memories, but I feel that it is desperately important to get in touch with them. And it is, I will hear people say that, no, you can't deal with it now, you may fall apart, as I said during my earlier talk. If you can deal with it as a child, you can definitely deal with it as an adult. Your options are much more. You have much more power. You have much more connections, support system. I will often hear people say, I don't want to confront my parents about my abuse because I don't have, I need to get a support system. The thing is, the onus of developing a support system is upon you. A support system doesn't come and knock on your doors and say, here, Marcy, we're here. Now you can go and confront your parents so that finally you can start being able to have a relationship with your husband and not be in a constant state of rage towards your children, okay? Because you have unfinished business with your parents. No, there has to be a sense of desperation in wanting to remember, in both remembering and staying connected to memories. When you have sessions with people that have abuse problems, they will quickly forget what was talked about in sessions. Many therapists have great difficulty asking about details of abuse. It is much easier to say I was abused than to describe the manner of abuse. Okay? Nobody wants to hear the manner of abuse. Okay? That is what turns your stomach. That is what makes you feel like the whole world turns ugly on you. It breaks your nice little cocoon where you can have, a little break at Denny's after the session. This is the kind of thing that makes you feel like you want to throw up. This is the kind of thing that makes you feel like you want to get up from your seat and hold them. And that is not right. Okay? Or so you're taught. And yet it is absolutely essential to get in touch with the memories of abuse, the details of the memories of abuse. And you can do it in various forms, which we can talk about in the next session. I see we're running out of time here. But body work, memory work, finding different ways and being taught different ways of self-nurturing, self-soothing, finding personal power, both through physical exercise as well as finding ways of being creative. These are all absolutely essential things that are needed to overcome the effect of abuse and ACA type of backgrounds that leads up to addiction and codependency. I've kind of touched on spiritual recovery and the essential thing about spirituality, or I hope I have. I have to say that it is the spiritual connectedness that begins recovery, that takes you through recovery, and allows you to enjoy recovery in its fullness. Okay? A lot of times when we talk about specific techniques, we don't talk about spiritual recovery. But it means taking the time. If you're abusing your drugs and alcohol, and your mind is clouded, you cannot be in touch with yourself. If you're in a relationship where you have to be somebody's slave all the time, you cannot be in touch with yourself. Taking time is an essential part of initiating spiritual recovery and continuing the spiritual recovery. Body work as a way of healing, it helps both to remember things as well as develop boundaries for somebody that has no boundaries, as well as take care of physical problems. When codependents and addicts come with all the multiple mood and behavioral and medical problems, I strongly recommend the body work, because you cannot talk people out of their symptoms. A lot of times, even when symptoms become less, my own feeling is it's because it's our sense of compassion, our being there regularly at 3 o'clock in the afternoon on Tuesdays for 2 years straight, and giving this sense of object constancy that makes the world more real and secure for them, that had more to do, and maybe the tone of your voice that had more to do with why the person got better. Okay? Because you treated them as a person rather than the things that were said. And in that way, body work is one more step. I will tell people all the time, especially when you have self-mutilation problems, eating disorders, that if they don't do body work, then I won't see them. I mean, I don't see patients individually now, other than consultations, but it's also what we do at the center. We insist that people get body work, and we establish safe distance. We don't throw them to a body work person the first day they come, but there is strong peer pressure and pressure from us to at least be in the same room as the body work person right from the beginning, so that eventually there will be a sense of safety and they can be touched and later on worked with, both in terms of recovering memories. There are many, many elements. Some of the things that we do at the center, again, are we do a lot of hypnosis, psychodrama, things like that. I'll talk more about some of these things when we do the inner child workshop later on. Exercise, very, very important, as I said earlier. Exercise, in a sense, it gives you this window of chemical change. Your autonomic nervous system is stimulated, and during that time, you can think things that you otherwise don't think. I mean, I've had pedophiles, for example, be able to think about their own abuse for the first time when they were exercising, because it was the first time they could think these thoughts without feeling the same sense of shame. Because when you're exercising, when you feel the power of your muscles, when you keep your body straight and feel the sense of energy, some sense of this internal shame begins to melt for the time being, and you can allow yourself to think thoughts that you normally don't think. I'm going to stop now, and many of the things that we will talk about later on will really kind of be a continuation of some of the things we talked about now. I didn't fill out the last part, but I have to say that once again, the codependency and addictions can take any psychiatric diagnosis: major depression, dysthymic disorder, bipolar disorder, cyclothymic disorder, schizophrenia. Because in the old days, anybody that hallucinated, as I said, was schizophrenic. Kleptomania, obsessive compulsive disorder, again, eating disorders. In old age, especially medical problems, especially that having to do with cardiovascular problems. A lifetime of lack of self-love, not exercising, not eating right, not sleeping, eating, all of these things take a toll early on, and you will find that people in their 50s and 60s don't have the quality of life. You will find a lot of people already broken away from their families, no connection to their families, winding up in nursing homes earlier, being abused within nursing homes. They're also more likely to show paranoid tendencies within nursing homes earlier, because if your sense of your internal sense is not one of safety, you begin to feel paranoid about the world. And as you become a little blind, and as you become a little deaf, the sense of safety becomes even more troubled. I mean, it always troubles me when people that are relatively together choose ways of killing themselves or show in their old age. I mean, you know about Bruno Bettelheim, you know, the way he killed. I have read very little of Bruno Bettelheim, but I have to, some of the things that have come out about him, about his way of treating children, is not very nice. You have to question somebody who lives, who kills themselves in this manner. You have to ask yourself, did they do their own work? Okay? Were they really healed within themselves? And how much can you really say about healing, and how much can you give if you have not healed within yourself? And I think for all of us, there is no stop in recovery. We go on and continuously look towards making changes in the positive direction and getting more spiritually connected. Any questions? Yes. Using the body both as a way of getting in touch with memories, defining bodily boundaries, finding and increasing a sense of trust, developing basic trust, rooting out psychosomatic problems, inducing flashbacks, inducing dreams, nourishing oneself, feeling glorious about one's body, learning not to be ashamed about one's body, using the body both as a vehicle for change, as in connecting to the past, and as well as using the body to celebrate oneself by dancing, by moving your body, by sensing the power of one's body. So both as a healing vehicle and a vehicle for celebration. So exercise in a sense is also body work. I mean, we can go more into it, but it takes various forms. Positioning, we do a lot of it, and we also send people out all the time to do body work with others. A lot of the body work can be done by yourself. I mean, to create a habit of laying in the tub and massaging your body with nice oils is body work, because it's self-nurturing, it's self-soothing. So body work has many, many things, parts to it. I consider, for example, giving somebody a pair of, telling them to wear cowboy boots because they can walk straight. And they can start looking people in the eye to be body work. Okay. For somebody to wear a brace so that they will keep their back straight is body work. So body work has many, many facets to it, and it has to be tailored. One of the things that I do is, that I love to do, is see somebody, a new person, a consult, for 2 or 3 hours straight, and give them a little prescription, you know, body work, like karate, back brace, cowboy boots, dresses and no more jeans, because they're unconnected to their femininity and or, you know, that kind of stuff. So that's all, to me, that's all body work, because it is allowing you to, in a holistic manner, get connected and use the most elemental, most vigorous part of you. It's there in my book. It's there. It's called A Step-by-Step Guide to Recovery for All Codependents and Abuse Survivors. There is also a long list of 180 questions that will help people do some of the child work, or you can use it in your practices. Yes?
This morning you said that all addictions are wounds of love, and that the only real way to address an addiction is through self-help programs. What do you think of rationally motive therapy and neurological programs?
I believe that it's one of the things that's helpful. You know, I think I clarified some of the things that I said early on about psychotherapy. I don't think psychotherapy in one form or many forms is bad, and I think a lot of times it can be extremely helpful. It's when it has an addictive, dependency-creating form that it's a problem. I think that many people need to be held, and like with other things, I think that the people that do the best rational emotive therapy, same as the people that do the best confrontive therapy or the best humanistic therapy, are the ones that love their patients, have a sense of passion in themselves, and have a sense of passion and compassion in their patients. I think we always have to love patients. They are lacking a certain kind of adoration in their lives that was never given to them. And if we don't adore them, if we don't treat them with the respect, and we don't enjoy them, it always bothers me when say, oh, I have to take 10 hours of patients. It's like, I got to take abuse for 10 hours. And I think, you should not be seeing patients if that's your mindset. I think being sacred, that it's an honor and an excitement for me to be there, to take part in this adventure with them. And I think then any technique that you use is helpful. But I think that without love, we are blind and we are deaf. And if the person doesn't feel loved and held, then they cannot hear and they cannot reason. And that all the cognitive therapy in the world will not work if we are not caring and respecting and loving and make our patients feel safe. I don't know if that answers your question. Yes?